So just real quick, I'm gonna explain the reason I founded ClarityReach maybe like almost half a year ago now. And the reasoning I did that was due to my own personal experiences with myopia and just observing the people around me. I thought it would be a good incentive to have a website that was just completely free where you could access reliable information to know how to get the proper treatment for your child, just without having to search so much. Because when I was younger, my treatment, my parents hadn't been able to find like the treatment options so easily. So that's
Mhm.
why I thought it would be nice to just have a center where you don't have to pay, you could just find everything. You don't have to go through like 30 different websites to find the information. So that's why, for the treatment side of things, that's why I founded it to make it easier for parents. And I guess for the kids side of things, to help children more understand what kind of like illness they're dealing with. Because when I was younger, I never actually understood what myopia was. I thought it was just, oh, I needed glasses. And I think it's really important for children to understand what they actually like have rather than just, oh, I need glasses.
Perfect. Perfect. Can I ask what age you got your first pair of glasses?
I think I was 3.
Okay.
Yeah, I was 3.
Okay. All right. And so you're candidate and tell me again your name.
Danya.
Danya. Okay. Beautiful
Yes.
names.
Thank you
Thank
so
And I'm
much.
Terry.
Nice to meet you. If you actually don't mind introducing a little bit about your background for our audiences at home, that would be great.
Sure, absolutely. So I'm Dr. Teri Geist, and I'm an optometrist, doctor of optometry, and I practice in Omaha, Nebraska. I'm currently the president of the American Optometric Association. So yeah, I've been in practice almost 30 years, and which seems like crazy. I'm not that old, you guys. But anyway, no, and I see patients from 6 months to 100 and everything in between. So do a lot of ocular disease, and fit contact lenses and basically do all primary care optometry. So the children's vision aspect that was very near and dear to my heart. We have in Nebraska where I practice, we have a Children's Vision Foundation that we know that children, like you all said, don't the information to get children into eye for eye exams, the information is not out there. And we're trying to get that information out there, and not just for myopia, but for all of children's vision, because children don't know to say to parents, "Hey, mom and dad, I can't see." They don't know what abnormal is, and I think parents kind of wait for they think that their children will say, "Hey, I'm having problems," but again, because they don't know what normal or abnormal vision is, they usually don't complain. And unless a parent or a teacher kind of recognizes that as far as symptoms, and there are a lot of symptoms, not just with myopia, that we need to kind of watch and pay attention to. So public awareness in with consumers, with parents, with teachers, with all of that group has been very near and dear to my heart because, like I said, I think it's such an important aspect, and it's not just again myopia piece, but it's all of children's vision. So that's a little bit of my on the children's vision part of the background. But I'm just would love to just say thank you for doing this, and I love that you guys have
Thank you.
that are doing this project. I mean, kudos to you.
Thank you.
Thank you for giving us your time so we can ask these questions. It'll really help with our website and building awareness.
Yes. Okay, so then I guess I can
Just
start.
start, yeah.
I can start. So I guess as someone who lived with myopia, I want my audience, I want families to understand that it's more than, just needing the glasses, as I stated earlier. So what do you wish every parent understood about myopia and just in general long-term eye health?
Absolutely. You know, myopia is the term nearsightedness, and people can see up close but not far away. And it's so much more than just wearing correction for glasses. It actually can cause a lot of eye health issues. And so while we want to make sure that a child can see clearly, or any patient can see clearly by correcting their vision, whether it's with glasses or contact lenses, we want to make sure that the eye health is important. Usually, we would like that patient, whether they're 3 years old like you were, or whatever age, to be dilated or cycloplegic with drops to make sure that the back of the eye, the retina, is healthy, because that's one of the things. Myopia is a risk factor for so many eye diseases, and so making sure the retina health is good and normal is essential. Not just when you're 3 or whenever you get your first pair of glasses, but throughout life, because it does raise your risk for retinal detachment, for glaucoma, so many other eye diseases. So that's the important part, is making sure the eye health is maintained and checked.
Mhm.
So I guess the main thing is to let parents know about the risk factor primarily.
Absolutely. Risk factors are huge. And if you've got two parents that are myopic and they have a child, that's one thing that I try to do with my patients, that if they're myopic and they're going to start a family, depends on who you marry too.
Mhm.
But anybody can develop myopia. And we're seeing such a huge increase in myopia in the whole world population. And it's not, but the risk factor of, if you are myopic and you have a child, or if you have the other parent is myopic, that increases that child's risk factor. So I try to educate my patients while they're in the chair to make
Mhm.
sure that they bring that child in, usually at 6 months, and just understand those risk factors before they plan a family.
Yes.
That kind of leads into the next question. At what age should parents begin discussing like myopia management with their eye doctors, and what are the options available for parents?
The nice thing is, there, because of the awareness, there are a lot more things involved, and
Mhm.
treatment options available than back in, my kids call it simpler times, or
Yeah.
when I was younger, back then. So there are a lot more treatment options available. We do want to make sure. So at 6 months old is when the
Mhm.
American Optometric Association recommends children of whether there's risk factors or not to get their first comprehensive eye exam. And that then leads to, again, that discussion with the parents as far as risk factors, because the treatment options, there are several. There are contact lenses. There are, again, glasses. There's atropine drops. There are some wonderful spectacle correction options now that are out there. So depending on, the parental, um, as far as how much support that child has, and the behavior of the child, and the how the child is, as far as how their maturity level, there's just so many factors that go into that, as far as, again, how there's cost involved, and all of those things that I try to talk to every parent about all those risk factors and all of the treatment options when we go through with that. But again, if there's a high risk, you want the treatment options, want to be, in my opinion, I want to start those early,
Mhm.
because I feel like the better, if we start earlier, the better the outcome. We also know that one of the best things is for children not to be on their devices, and be on the digital devices too early in life. I just had my first grandchild, and boy, I'm going to be a fun grandma, where I'm not going to want them on devices all the time. They need to be outside 2 hours a day. That is one of the biggest things that we can do. We know, during COVID, I try to think of positive things,
Yeah.
about COVID, and all of the things that we experienced during that time. But
Yeah.
the public awareness of digital devices, that was one good thing that came out of that, is
Mhm.
letting the parents were finally talking about, gosh, my child's now on a digital device, whether it's a iPad or computer screen.
Yeah.
Parents were thinking about that now more than ever before. So it started the conversation about digital devices, and what the long-term health of the eyes were because of that. So again, I feel like that's been a really good conversation starter with parents at a
Mhm.
younger age, where children should not be on digital devices at a very young age. They should, again, be running around and being outside and doing all the things. Now, we want kids to read and learn to read, so it's all in moderation. And it's not just sitting in front of a computer screen or a TV screen playing games. So, like I said, I'm going to be a fun grandma, but I also want it to be in moderation and the right amount of time.
So I guess it's more or less, it's not about the device itself, it's more kids need to spend time outside.
Exactly. All in
Yes.
moderation. And I know,
Mhm.
like, I, being a nearsighted child as I was at that age, I am an avid reader. The other thing is, when you're a myopic child, your comfort zone, your visual comfort zone is up close. So
Yes.
if you
Yes.
got a world that is far away blurry, your comfort zone is here. So as far as what makes that clear, and so it is not uncommon for kids to want to read, to want to be to hold
Yeah.
their digital device up close, because again, it's clear there. It's not clear anywhere else.
Yeah.
And so, again, I love these avid readers, and I never not want them to read. I mean, both my kids are avid readers, and I've got one that's a little bit nearsighted and one that's a little bit more. So, not nearly as what I was, but again, they were also outside playing a lot. So,
Yeah.
again, that's that fine balance of moderation.
Yeah. I do remember when he was little, he used to stand like directly next to the TV to watch.
Yes.
So I guess that was a clue that there was something going on.
Exactly. Yes, absolutely. Now, can I ask real quick? This is, are your parents nearsighted?
No, but they do have vision
Yeah.
issues. Both
Okay,
of
all right. It's always interesting to see the genetic pieces of that. So,
Yeah. All right. So, as AOA president, how is the AOA working to improve insurance coverage and affordability for evidence-based myopia management treatments, like the treatments you mentioned earlier?
well, so during the Affordable Care Act, we do work with regulatory bodies about making sure that children under the age of 19, under the Affordable Care Act,
Mhm.
have vision insurance. So that is under the Affordable Care Act, there is a
Right.
provision for children to have a comprehensive eye exam every year. So
Mhm.
that is, we want to maintain that with all the new regulations that are going to be coming out. So
Right.
that is something that we find essential. A lot of parents don't know that that's under the Affordable Care Act,
Yeah.
and they're worried that that is not covered, and it is. So myopia management is not covered, and that's something that
Mhm.
we would like to see happen, because again, you look at the long-term health effects and the
Mhm.
cost of that. So we are absolutely looking at ways to be able to have that covered for your future. But right now, just making sure that children have affordable annual eye exams are the
Mhm.
biggest thing that we've tried to do. Now, working with industry and
Mhm.
making sure that a lot of these products are covered, as far as the new eye care products and the
Yeah.
contact lenses. That is something that a lot of the insurance coverage are now covering,
Mhm.
and the FDA has approved the atropine now. The only
Oh.
thing is, availability is difficult. So there is, it's a challenge to get sometimes the depends on the dosage. And
Yes.
again, it's depending on the age of the patient, what dosage some doctors want to use, and for different reasons. And so that's one thing that is challenging to get um, that that covered. So sometimes you have to use specialty pharmacies. So that makes it a little
Right.
bit more challenging in availability.
Yeah.
Yeah.
I know that he was trying to get atropine here in California, and it was kind of a struggle to get it shipped. So I'm assuming like
Yes.
it depends on the state with the availability regarding atropine.
Yes, it is.
Okay.
It's challenging. So I recommend talking to your doctor of optometry that you see and find out if there is a specialty pharmacy that they work with. Most doctors have a specialty pharmacy that they work with that they can hopefully get that availability to you.
Mhm. All right. So, what makes someone a good candidate for treatments like atropine or MiSight lenses?
Again, depends on the age, and that's a great discussion with parents. And again,
Mhm.
depending on the age of the patient and maturity levels and all those things, contact lenses inherently um, come with some risk because
Right.
there's an issue with having disease processes that can happen, or risk of infection, I should say that.
Right.
So handling those lenses are the same type of risk factors with any contact lenses. So you have to have parents that are willing to be able to help with insertion and removal, with sterilization, with all of the things that sometimes younger children have a harder time with. But it always surprises me how young kids sometimes adapt to inserting and
Right.
removing contact lenses, sometimes better than some teenagers. And
That's
so
true.
it is actually kids adapt really, really well, surprisingly well. So they surprise me every day, I think, in practice, how well that they sometimes will do. But again, it's the biggest thing is making sure that they, the cleanliness and the sterilization issues as far as washing hands appropriately and keeping clean surfaces and those just general hygiene issues. But again, we have to have parental buy-in, and we have to make sure the parents understand all of those things before we start on like a contact lens approach. Again, then if unless an atropine might be a better option,
Mhm.
and a lot of times, with any treatment option, a lot of times we'll do one treatment option and then see how we do, then add
Mhm.
another if we need to go with the MiSight lens, and then maybe add atropine if we're not getting to where we need to be. Again, the risk factor there, if I've got parents that are, like myself, it's a -13. Luckily, my
Mhm.
husband didn't have any need for correction. So at least one out of two, my poor children only had one out of two parents that were the difficult issues. But, if I had both parents that were fairly myopic, I
Mhm.
might consider, more aggressive treatment options at an earlier
Gotcha.
age. So there's lots of risk of issues, but I guess the parents have to really be on board with whichever treatment option we choose. But we try to lay out all of the options to parents so they know all of the issues right off the bat, and then depending on the age group and the risk
Mhm.
factors, we go with a different treatment option. I think
Mhm.
you're going to talk to Dr. Curtis Ono at some point, and well, I think you're talking to Dr. Gossard, but Ono that's all he does is treat children. So I
Oh,
think
wow.
he's going to get on your schedule at some point, and he'll be really great about answering some of those questions also.
Awesome.
So then I guess kind of on the topic of the future in children, I usually wonder like what future patients will have that I don't have when I was a kid, things that I didn't have. What breakthrough or change or research gives you the most hope for the future of patient care here?
Well, it would be, I think when we're all gone, all the different genetic, issues that we're going to find, that hopefully we can do some things that are, like I said, way down the road. But I do
Yeah.
think there's going to be continual improvements in contact lenses and glasses options. I
Mhm.
hopefully, like, because of people like you and having the awareness, and just of making sure that children get exams at an earlier age. That's huge. That is huge. And the awareness of making sure they're outside 2 hours a day and not being overboard on digital devices. I think that right there is huge. There's some theories that I've actually heard that if kids were outside 2 hours a day, what that would do to our population. Because you think
Mhm.
about the risk factors, genetic risk factors, and it's not all genetics. I mean,
Right.
they're estimate, by, I think, is it 2050, that there'll be 50% of the population being myopic. That's not all genetics. That
Right.
is
Yeah.
absolutely environmental factors. So it would be amazing if we were not, I mean, again, we're all tied to our phones and our computers and all the things. If we were not doing that, what would our world look like? So just public awareness
Mhm.
is just a huge thing. So, but there are continual, I think there's going to be new medication options as far as, atropine shouldn't be so difficult to get.
Yeah.
First of all, cost wise or pharmacy wise or
Yes.
any of that. I do think that there'll be a lot more options in glasses and lenses, and I
Mhm.
think there'll be a lot more options in contact lenses.
Yeah.
Per-
It's funny you mentioned the cost of atropine because my next question relates to that sort of. I recently
mhm.
learned that my compounding pharmacy may no longer, she mentioned earlier, be able to ship my atropine prescription to where I live, California. So,
Hmm.
do you know why out-of-state compounding pharmacy shipments can become restricted? And like, I guess when this stuff, when a scenario like this happens, what should families ask their doctors or pharmacies?
And that's a very good question. And I honestly, this is one of those that I honestly don't know the answer to that.
Mhm.
Um, and so I'm going to say I don't know. And again, some of my colleagues may know that much better than I do. But I think talking to your local, whoever your doctor of optometry is, every state has different laws,
Mhm.
and we have 50 states, and
Yeah.
the different laws make it a little bit more challenging where you are at. So I think making sure whoever is prescribing your atropine help you find the compounding pharmacy. I think that is the biggest thing. And if you're getting it out of state and having it mailed, that's something that, again, I would ask your pharmacist and your
Mhm.
doctor of optometry how to get those.
Yes.
Mhm.
So, yeah, that's very interesting how the different states kind of affect the certain care that populations can get. Um, and I guess that doesn't just apply to states, it also
Yeah.
applies to countries. Me and my sister, my family, we went to China a month ago and we interviewed some doctors of optometry and ophthalmology over there, like asking sort of similar
Yeah.
questions. And one of the things they're very adamant about that they would mention in China was artificial intelligence care regarding the
Mhm.
diagnostic for myopia or just eye diseases in general. So, can artificial intelligence predict individual myopia progression and create like personalized plans for individuals? Do you think that'll be useful?
Absolutely. I mean, that's the thing with AI. We want to embrace the great technology and not embrace the not as good. But I do think that AI is going to be extremely helpful in the
Mhm.
future and not so long future, as far as trying to figure out. That's where you talk about the amazing things that will, probably when I'm done practicing, how cool it will be to be able to look at, maybe we're not treating it fast enough.
Mhm.
If we've got a kid that, is 3 years old and we know that maybe the parents aren't that hugely myopic, but because of certain genetic predisposition, maybe a
Mhm.
grandfather or somebody, was, and we don't have all that access to the history. It might be wonderful to be able to tap into that sooner than later. So no, I think AI is a wonderful way to be able to um, hopefully predict things faster, and
Mhm.
but we want it to be accurate information. That's the biggest thing is with the AI is making sure that we have the great technology to be able to accurately predict those types of treatment options.
Mhm.
Yes.
And it's
So,
interesting that the Asian population is more likely to be nearsighted,
Yeah.
and that's the other thing that's fascinating. Um, I wish there was a study. Are they are they inherently, did they do a lot more reading? I mean, were they not outside as much? I mean, that I think that is fascinating, and I don't know
Yeah.
the answer to that.
they
And I
actually
don't know, did they comment on that?
yeah, they
Yes, they
actually
did.
did comment on that. When I went over there, they would ask me, they would be like, how is the rate of myopia in America? in China, they actually, one of the doctors told me they have a higher rate, their populace has a higher rate of myopia due to the fact that they have, I guess, almost more intensive studies for younger populations. And due to
Yes.
the just amount of technology that they use in their daily school life, their population often finds themselves inside. Not that ours doesn't, but theirs to a more significant extent. So
Yeah.
they actually said that they have a higher rate of myopia in their population.
There was something I read someplace, and again, that, just if there were more, 2 hours, if they did 2 hours of again outside play, if they worked that into the curriculum, it'd be fascinating to
Yeah.
see what that would do. And again, weather plays a role with that, but or if you can't go out in the blizzard and those kinds of things, but
Yeah.
it it, it would be fascinating to see if that's the reason.
Yeah, I know that in our case, we definitely had a school that prioritized going outside. Like we would have some time, to go run around as kids. And when we spoke to the doctor in China, she mentioned that how they're trying to implement that policy in their schools to get more children out. The 2 hours a day that you mentioned, it's like a constant, even globally. So I feel like we really need to move to get that
Yes.
more prevalent for our kids.
Yes, absolutely. And this is, I don't know what resources you guys have now, but
Mhm.
AOA.org is our or association that you can get some really great information about all of this.
Yeah.
So that's something that would be might be helpful.
Thank you so much. Yeah.
Yeah.
So for my next question, what is
Yeah.
the biggest misconception policymakers or insurance companies or healthcare leaders may have about myopia that can influence how decisions are being made?
I think the biggest thing that again, I think that they think that kids are getting the care they need,
Mhm.
and they're not. A lot of times, and it can be in all different demographics, socioeconomic demographic, where kids will not pass a screener, like a
Right.
school screening at the school nurse, but then they don't get the follow-up care that they need at a doctor of optometry or any healthcare provider. So I think there is a big gap in coverage and care that parents aren't getting those children to the healthcare provider that they need. And so
Mhm.
that is a huge problem that we're seeing all over the country. And it's critical that we don't lose those kids because if you can't see in a classroom, 80% of the classroom is through your vision as far as what you're learning. And so it is extremely important that the kids get this care, but there's a big gap in not people assume they're getting the care and they're not getting the care.
Yeah.
So Dr. Gossard, who you're going to talk to next, you
Mhm.
can ask her about that. Nebraska has a big, where I'm at, but
Mhm.
Ohio also has a huge, where she's at, has a really big, uh, it's called the Ohio C, and
Mhm.
they have a big community care outreach for this type of situation. So that might be something that you want to talk
Mhm.
to her about, and she would
Yeah.
be really helpful. She's our president-elect right now for the
Okay.
AOA.
Hmm.
I mean, like you mentioned before, the comprehensive eye exam, even that information, I feel like it's important to just get it out there that it's covered, because I feel like we need to prioritize our vision. Most people don't think that they need to start early, so I think it's important that people know this information.
Yes.
Well, and people also, I'm sorry to interrupt you. People think that if they see fine, that their eye health is fine. And
Yeah,
that is not, and that's of all ages. So,
right,
oh, I see fine across the room or up close or whatever. And every buddy needs a comprehensive dilated eye exam.
right.
Um,
Okay. So is there any like research being done on environmental triggers of myopia? And what can we do to offset these causes? Again, I know you mentioned the going outside, the 2 hours. Are there any other specific environmental triggers?
um, That is, as far as environmental triggers to help or to hinder, I guess
To hinder.
to hinder. Mostly all the up close
Right.
work, that's the biggest thing is we're seeing that, again,
Mhm.
I never want to tell kids not to read and not to do all the things to stimulate mind. So that's always that fine balance is and not stimulating those types of issues, but
Mhm.
the up close work is what we really see is the
Mhm.
biggest issue. And I was the kid back before. See, I'm aging myself. We didn't have digital devices back in those days, but I had the flashlight underneath my covers reading when I was trying to turn the light off, you know, stop reading kids and go to sleep, and I had the flashlight underneath my covers, reading. And I know that had to have played a role because my family, nobody's nearsighted like I am,
Right.
and that axial length, my axial length and my eyes are extremely long, and so
Mhm.
I'm not saying that was all it, but I know that that probably did not help things.
Yeah.
So anyway, go ahead. Did you do the same thing?
Yeah, I was gonna say when I was younger, I had a video game device and I would play on that, and my parents would see me playing and they'd be like, you're playing too much, do something else." And then I would just start reading, and obviously like a parent sees their kid reading, they're like, "Oh, that's a good thing." But the issue is like
Yes.
I would have it like right up to my face.
Yes, yep, exactly. But no, I know the reading, all that stuff is so important. Like,
Yeah.
but that was one thing. I don't know why, hardcover books are gone because I think we bought every book known to man for our kids,
We
and
were
they
in the
read
same
them. So
household.
yeah.
So how could the AOA better promote or improve participation in early eye exams and early intervention for things like myopia?
Well, we have a public awareness campaign called I Deserve More.
Nice.
And that is a social media, mostly social media based, earned media and paid media advertising campaign.
Mhm.
And it's actually really great. And we try to put patient stories out that what we do every day in our exam rooms.
Mhm.
And basically talk about the importance of eye care at every age. But one of
Right.
the things that we do try to highlight is children's vision, especially the back to school time,
Mhm.
and the importance of getting early intervention at a young crucial age. So not just myopia, but all binocular vision issues,
Mhm.
hyperopia, which is the opposite of myopia, because the the long-term effects of not being able to see well in a classroom, it affects socioeconomic,
Right.
self-esteem, all of the things that are so important throughout school and throughout your whole entire life, that a simple eye exam is something that can change a child's life and
Right.
set them up for success throughout their whole career, whether that's, depending on what you choose to be when you grow up. But it's essential, but that we see that as a big piece of what we do as educating the public.
Mhm.
Yes. So then I usually ask this question at the end of most interviews. I asked it to the doctors in China, and it's the same question, but I always think it's really important to ask. What is one practical action parents can take, maybe like soon, I guess, for a parent like this month? What is a practical action they could take to protect their child's vision and learn more about myopia? Say, like, they just saw this interview or they just like got information.
Schedule their child's back to school eye exam. That's the biggest thing. And this is the perfect time to schedule that eye exam before the kid goes back to school. An annual eye exam before, just like buying new shoes and a new backpack.
Yeah.
Back to school eye exams are extremely important to make sure your child is ready to go and doesn't have any needs, vision needs at this time. And it's summertime, so outside sunglasses are helpful, and because we always want to make sure the rest of the eye health is maintained, but um, have the kids outside playing too.
Yeah.
Yeah, definitely have to bring back outside time more. I feel
It's
like We
It's
had a lot
huge.
of the park growing up. We got to bring back the park.
Yes. So you're how much power do you wear contacts too?
I wear them occasionally, yes.
Okay. Yeah. What's great is the one-day disposables are
Yeah, I
wonderful for
have
part-time
those.
use. They're the easiest, they're the least risk of infection, they're fantastic. So good. I'm glad you got a combination.
I guess the only issue I ever had with contacts was when I was first starting them, because I started them at a, I guess, later age, like when I was
Hmm.
more in my teenage years. I remember this vividly, and after this, I learned how to put them in properly. Or take them out. I had my contacts in, and I was trying to take one out, and then pinched my I pinched my eye, and then
Hmm.
like I just never forgot that experience. And I'm like, okay, now from now on, I gotta be careful when I'm taking these out.
Yes. And it can scare you so much. We try in our office to make sure that kids make sure that they can do that themselves several times before we send them home. And but again, you can have something you're in a hurry or something you're at school or something happens where and even adults can do that. So
Yeah.
any new wearer, contact lens wearer, I always try to tell people like the first day of school is not the first time you want to put that first contact in. You want to have plenty of time, not be stressed out, and be in a comfortable environment to be able to put them in and take them out because it can be a stressful thing. And if you have problems, you want to make sure you have plenty of time to take care of it if you need to. But yeah, you're not the only one that's ever gone through that. It can be kind of traumatizing if it is. So
Lots of practice, I guess.
Yeah.
yes, lots of practice. Exactly.
All right. So thank you so much for all of your time. That's about all the questions we had. And we really like, again, thank you so much. We learned so much out of this.